right. Well, I wanted to welcome you guys again this afternoon. We just had a great lecture on finding a specialist and navigating a possible second opinion and how that can help you in your cancer care. Now we're joined by Dr. Sarah Sutka. She is a doctor from the University of Washington, Fred Hutchinson Cancer Center. She's an associate professor of urology. She's going to be talking about navigating financial toxicity. And so if you guys have questions, remember to put those into the chat and we will try to get to as many of them as possible. So Dr. Sutka, I'm going to turn it over to you, and I hope I did not butcher the last name. So I'll chat it over.
That was brilliant. I always say it's like the stuff in the chimney. Sutka. You got it right. I want to thank the KCA for the opportunity to speak with you today. We're going to talk about something that I'm actually really passionate about. So I'm going to go ahead and share my slides. And we're going to get going. Can I just get an okay that you can see my presentation okay?
We can see it.
Excellent. Here we go. So my name is Sarah Sutka. I am a urologic oncologist at the Fred Hutchinson Cancer Center in the University of Washington. And I want to talk today about navigating financial toxicity. The goals of this presentation in the next 30 or 35 minutes or so, we're going to talk about what is financial toxicity. We're going to talk about why it matters for our patients and their families. And then I wanted to spend some time talking about pragmatic ways that we can try to reduce financial toxicity and then provide some resources for all of us, for both patients and family members and providers. And what I hope you will take away from this presentation is, first of all, understanding what this problem is and giving this problem a name, because I think it's something that financial toxicity is something that all patients experience, yet a lot of patients don't understand exactly they don't necessarily maybe have the language to kind of to name the problem and therefore start thinking about really actionable, pragmatic ways to solve it. In general, I think that it's important to know that financial toxicity is a major problem, especially in this country. There are potential solutions, though, and I really hope that by giving starting to put some language to all of this, we can empower ourselves to speak up, and then hopefully this can help you partner with your provider. And I think that I just caught the tail end of the last session. One of the things that you're going to be hearing over and over and over again, and I think this is something that is so important about healthcare in general in the 2020s, is that the relationship between a patient and a provider is really important. And I think that patients should feel empowered to partner with their provider and sort of navigate these problems together. And you'll find, I think, in most cases that the providers are very not only willing and able, but very excited to work with you to try to improve and find the creative solutions that allow us to deal with financial toxicity and start to try to minimize its impact. So let's just talk broadly. What are the goals of cancer care? My goal as a provider, as somebody who takes care of patients with kidney cancer, is to not only improve the length of life for my patients, but really importantly, to improve the quality of life of my patients. And there are a lot of things that impact quality of life, which you see here in kind of the center of this diagram. So there's the physical experiences, there's the psychological experiences of managing and navigating a diagnosis of cancer and its treatments. There's certainly all of the social aspects, and I think the social network that a patient has is so critical, but financial burden is a key contributor to health-related quality of life. And the truth of the matter is, financial toxicity is a major problem in oncology, especially in this country. So what is financial toxicity? This was a term that was coined in about 2013 by researchers from Duke. And specifically, they said financial toxicity. It comes from this kind of observation. So out-of-pocket expenses might have an impact on the cancer experience as to warrant a new term. They called it financial toxicity. Researchers noted that out-of-pocket expenses related to treatment are as important as physical toxicity in that costs can diminish the quality of life. And obviously, our finances and our financial health and our financial well-being are critical to our ability to continue to sort of navigate our existence in this world, because that is obviously critical. Patients have a lot more worries than simply, and I say simply in sort of quotations, the diagnosis. We have to navigate living with these diagnoses. And so the financial costs of being a patient are essentially, and the costs of treatment are what is described as financial toxicity. And what is the scope of this problem? Well, the truth of the matter is financial toxicity is incredibly common among patients with cancer. And I'm going to spend a few minutes now giving you just sort of a broad overview about what we know about the status of financial toxicity in the United States. So there are some pretty striking statistics. 59% of Americans are pursued by a debt collector because of past due medical bills. And this is current data. 16% of Americans, their credit reports include medical debt. And up to a third of US families report struggling to pay medical bills or defaulting on payments. And when we get into the literature, cancer diagnoses are associated with a number of hardships, behavioral hardships, psychological hardships. Material hardships means sort of navigating the sort of the diagnosis and the management. And but I think that what's really important, and you'll notice here, is that of all of those different hardships, medical financial hardship is the most common. And this was a survey study of 254 patients back in 2019. And it was interesting that whether patients have a low deductible insurance policy or a high deductible with or without a health savings account, medical financial hardship in patients who are under the age of 50 and over the age of 50 is incredibly common, reported by nearly 3/4 of patients, when those patients with a high deductible. When we look at what patients tell us about their experiences, especially in younger patients under the age of 65, we see that up to a third of patients say they have a hard time paying their medical bills, especially among those who are uninsured. But even among patients with private insurance, you'll see here up to 16% of patients say that they have a hard time paying their medical bills. And those are patients with private insurance. Public insurance, 28%. Any financial burden of medical care among the underinsured, nearly a half of all patients under the age of 65 endorse that. Over the age of 65, we do have some added coverage with Medicare and Medicaid, but still in that age population, between sort of in the high teens, currently say that they have a hard time paying their medical bills. They have medical bills that are being paid over time. They have medical bills that they're unable to pay. And then in terms of endorsing any financial burden, it's actually relatively common even among patients who are on Medicare and Medicaid. So this is a major issue. And this was an interesting study where patients were asked to keep a cost diary and basically explain to sort of keep track of all of the things that contributed to their sort of payments related to their medical care. And interestingly, in this sample of 159 patients, the average out-of-pocket cost per month for having a diagnosis of cancer was nearly $500, in some cases close to $1,000, which is a lot of money. So I think that this, we start to understand a little bit more. This is another survey study that sort of looked at annual out-of-pocket costs of cancer care across various insurance programs. And you'll notice here, so averages are in blue, but the 90th percentile is in orange. So average out-of-pocket costs per year, if you're on Medicaid, is about $2,000. But if the 90th, that's the average, that's the mean, but the 90th percentile can be up to nearly $8,000. And you see here that if in patients who are not insured, out-of-pocket costs for cancer care, it's about $8,000 a year. And in the 90th percentile can be close to 20,000, which is obviously a major problem. If we try to create a different statistic, so financial burden is described by it's the ratio between those out-of-pocket costs compared to the total household income. So of all the money that's being brought in over the course of a year, how much of that is out-of-pocket healthcare costs? And you can see here that ranges in the average range across insurances from about 5% for patients who are being cared for in the Veterans Administration system to up to about 24%. So up to a quarter of all financial income in patients who are uninsured on average is spent on on health out-of-pocket costs for cancer care. Now, among patients with in the 90th percentile, that goes up pretty substantially. So again, in sort of among the 90th percentile, even if you have insurance, it's somewhere between a quarter to up to 63% for those who are uninsured of your total household income per year. So obviously we're talking about a substantial amount of financial burden. And this is something that I think that the reason I don't put these numbers out here to be scary, but I think it's really important that we understand, and this is really important, especially for physicians, to understand the magnitude of what our patients are facing, and something that as I've sort of read more and more about, I've become really interested in trying to actually characterize better, because I think it's something that until recently we didn't pay enough attention to at all. And it's only now that we're sort of, I think, fully understanding the implications of healthcare costs for our patients. There are some things that have helped. So Medicare Part D, which substantially reduced the cost of a lot of drugs. And you can see here, these are a number of the targeted agents, many of which are used in kidney cancer. You can see that we were able to substantially drop the annual cost of these drugs between 2010 in blue and 2020 in yellow. But nonetheless, a year's worth of these drugs still cost, here's sunitinib, on average $10,000. So very substantial cost. Obviously, in patients who don't have insurance, that is falling on them. So we need to find ways to navigate this toxicity in order to ensure that our patients are able to get the treatment that they need. So what are the contributors to financial toxicity? Well, there's sort of three kind of buckets. The first is health insurance status. We talked about the fact that across the different insurance strategies, that financial toxicity does vary fairly substantially. So it's important to ensure that when you're looking for health insurance, that you have adequate coverage to minimize those out-of-pocket costs. And also insurance is important it's important to find assistance to ensure that you can kind of navigate the differences between policies, because obviously none of us, or very few of us, are insurance experts. Insurance is helpful in terms of consumer protections and also just navigating medical bills. Employment changes obviously impact financial toxicity, especially I think and then we kind of get into what are called the indirect costs. So whether or not a patient is able to work while they are undergoing treatment is a major issue. So, and the other thing is, I think what I worry about for a lot of my patients is just how their treatment, even if they're able to continue work, how daily treatment might impact their ability to work a day here and a day there, which ultimately can sort of contribute and impact their the amount of sort of their net financial gain over a year. A day off when you don't have a sick day is lost productivity. But it's not just for the patient also. Don't forget that if patients aren't able to work, and then their caregivers also have to stay at home to take care of them, then that may mean that 2 salaries in a household are no longer coming in. And disability insurance, I think, is something that's important to sort of understand and navigate as well. And then, of course, life changes. We unfortunately, even when we have a diagnosis such as kidney cancer, the remainder of life goes on around us. And we have to think about if we have families taking care of our kids or taking care of our other family members who are responsible for paying for our mortgages, paying for food, and then, of course, navigating relationships. So all of these things can ultimately contribute to financial toxicity. And the impact of financial toxicity on patients is substantial. So not only does it contribute to financial strain or at worst risk of bankruptcy, but it directly impacts things like survival and quality of life. It increases anxiety and distress, and it actually is associated very clearly with increased physical symptoms related to the cancer, as well as psychological symptoms. So the impact of this problem is substantial, and I think that when we think about it, so there's the material conditions. There's what is the problem? The problem is the medical debt, as well as the reduced or lost income. So the lack of money, putting it very simply, that directly results in a very strong psychological response. When we are not financially safe, that is a major worry for all of us. It's not only important, we worry not only about our ability to pay our bills, but it can come down to things like putting food on the table or being able to make your mortgage payments. And that causes a substantial amount of distress. And then the coping strategies with that can directly impact outcomes. And I'm going to talk a little bit about what we know about how patients cope. And then what I want to do is actually put forth some pragmatic solutions that can be, I think, very helpful ways to think about how we can cope with financial toxicity. So what do we know about how patients cope with the financial toxicity of undergoing treatment for cancer. So this was a survey study where they did a really beautiful job of getting into how patients handle the cost of prescription medications to start. So there was one way that patients cope with the cost of prescription drugs is that they change how they get their drugs. So they get samples from their doctor in up to over half. They go to different pharmacies to find the lowest cost. They ask doctors for a cheaper drug. They buy over-the-counter meds instead of getting the prescription. Some patients, and I actually have a lot of patients who do this, will buy medications in another country. In very rare situations, patients will use medicines from another patient, or in patients who can get their drugs through the VA, that can help a lot. Patients will alter their lifestyle in order to be able to pay for their prescriptions. Up to 46% of the patients in this survey reported that they spent less on things like food and clothing in order to pay for their drugs. They borrowed money or used credit. That's very common. And then some people actually said that they stayed an extra day in order to get some coverage. And then other patients, and this is, I would say, a strategy that we know happens, but makes us as providers worried, because it means that patients aren't necessarily getting the drugs they need. They maybe didn't fill a prescription. They filled only part of it, or they took less than they were encouraged to or recommended to, because they couldn't afford the prescription. What about how do patients report that they cope with the cost of their cancer care aside from meds? Well, patients sometimes report that they alter their care. They spread out their clinic or chemotherapy appointments. Patients who we are trying to see patients every 3 months, because we know that that's the guideline recommendations for the intervals that they should be coming in for their CT scans. And I have patients who say, well, I'll be there in 4. So it's one less visit over the year. And we understand that. We try to work with patients, but that happens. Patients sometimes don't get the test that they're recommended to get, or they choose one doctor or another. And this is especially important. And this is actually an important strategy, especially if your doctor's out of network. They didn't get a procedure they were recommended to undergo, or they missed an appointment. But I think the other way that patients clearly report coping with cost of cancer care is they change how they live. They decrease the spending on leisure activities, the things that they enjoy. They used all or some of their savings to pay for their cancer care. They reduce spending, as we talked about before, on the basics. They borrow money. They sold their possessions or their property. I've had patients who have unfortunately had to sell their houses. They worked more hours, or they had family members work more hours. So clearly the costs of cancer care impact the way a patient lives their lives substantially. And I think this is incredibly important for us to recognize, especially as physicians and sort of in the medical community. But I think that there are strategies here that I think can be very successful. There are strategies that we hope that we can find ways to avoid. And that's what I want to talk a little bit about next. So let's talk strategy. The first thing is, let's talk a little bit about medical insurance. Now, I'm going to give you a disclaimer. I am not an insurance expert. I'm actually a Canadian who is trying to navigate the American healthcare system, but I have tried to learn a lot about how to help my patients in terms of advocating that they do have good insurance, because we know that insurance is really important, especially when you're dealing with a diagnosis of cancer. So there's important strategies to reduce financial toxicity in terms of optimizing your insurance and helping it work for you. So making sure you have insurance, making sure you work with an insurance advisor to understand your plan, and make sure it's the right plan for you. You want to make sure that your providers and hospitals are in your network to avoid unnecessary out-of-pocket charges. And then, of course, you want to understand prescription drug coverage. So which drugs are under your formulary, and is there a separate drug deductible? These are all questions that when you're starting to look at what insurance you're going to obtain, that you make sure you have them answered. And then you really do want to make sure your health insurance works for what you need. You want an adequate plan. You want to know your details. Specifically, you need to understand when you're selecting your plan, what's the deductible? What do the copays look like? What's the coinsurance? What are the maximum out-of-pocket costs for the year, so that you can try to sort of navigate and ensure that you've chosen the optimal plan for your needs. Again, I'm going to make a plea that you try to choose in-network providers whenever it's possible, and then use the out-of-pocket maximum to your benefit. As I said, I am not an expert on insurance, but there are people out there who are. And I think that the KCA, this forum last year, had a really brilliant talk that I actually went to and listened to myself in preparation for this talk, that was given by one of the the folks working for Triage Cancer, who have put together a number of tremendous patient-facing resources that explain health insurance policies, that talk about how to pick an optimal plan, and they have advisors and who can help you sort of navigate this decision making and give you some really, I think, helpful mentorship as you are looking to potentially change insurance options. I think this is something that I sort of help a lot of patients through, is when a claim is denied. So unfortunately, claims are denied more often than we would like. And I'm sure that everyone on this call has maybe unfortunately had to deal with this, whether it's with respect to a medication or a scan. If the intervals are that maybe your physician's following guideline-based care. I happen to know that several insurance companies utilize and recommend different intervals of scanning for surveillance after treatment for kidney cancer. And I often have to go to them and actually say, no, my patient has a high risk disease. I need to scan them more often because of the risks of recurrence. And so I think the first thing I would say is, if you have a claim that's denied, partner with your provider. Your provider, will often be very helpful here. We can do peer-to-peers where we actually just discuss with the insurance company why we ordered a specific scan or a specific drug. We can advocate for you getting that necessary service. We can also provide supplemental information that allows an insurance company to kind of meet their criteria so that we can get you covered. But then if that doesn't work, there are also external appeal options. And so these can be either independent or external medical review that can either be through an independent company, or they can actually be county and state or federally available. These are generally pretty low cost to undergo. And there's a website, if you go to healthcare.gov, there's actually a tremendous number of resources around this. So if you are navigating the sorry, we're going to be Zoom bombed by my dog here. If you are navigating a denial, this is a very important thing to be aware of, because the truth of the matter is very few denials are appealed, but the majority of appeals, if appeals are made, are actually decided, up to over half can be decided in the favor of the patient. So it's important to be organized. I think that this is something, if you have a denial, that you should feel empowered to think about appealing. And there's these great resources, like I said, on healthcare.gov that can help you to navigate this. In terms of decreasing medical costs, I think there's a number of other things that we can do that are both pragmatic and very actionable in order to reduce the financial toxicity. And obviously medical costs they come from a lot of different places. It's the bills from the hospital, it's the bills from the provider, it's the bills for the medication, but it's also all of the other things. It's the time away from work, it's the time away from taking care of the other people in your life, and it's the time that the people who are taking care of you are taking off in order to bring you to your healthcare appointment. So I want to take a few minutes and really spend some time sort of getting through how we can lower our bills. You can lower your bills before getting care. This actually starts in the very first consultation. And I've actually started the practice where as I'm taking my social history, talk with patients about what their healthcare financial concerns are, so that I can kind of understand what them coming to see me means for them from a financial perspective. So sometimes I think that a lot of times, providers, we may not know how much treatment is going to cost, because those costs are actually not very transparent. The cost of a drug depends on the hospital you're getting it at, the insurance company that's paying for it, the state that you work in, the costs that the insurance companies have sort of have delineated with the pharmaceutical companies. It's not super easy, but one thing you can do is you can ask for your hospital to give you an estimation of how much that's going to be. And then you can understand things like what the out-of-pocket's going to look like. It's important to know how long the treatment's going to last and whether or not that treatment is going to impact your ability to work during that time. And again, check and make sure your providers are in network. And if they're not, sometimes there are ways to kind of navigate that. For example, VA patients are able to, if there isn't someone at the VA that does what that patient needs, you can find ways to sort of make an appeal and have your VA coverage cover you in another institution. And similarly, if you're in a situation where You need specialty care that's not offered in the hospital that is in network. Sometimes there are ways to get around that. I think involving a hospital social worker, navigator, or case manager can be very helpful in these situations in order to understand not only what costs are going to look like, but also to see if there's any financial resources that you might be eligible for. I think it's important to again, communicate openly with your provider before you begin care about what your financial concerns might be. And that's very important. You can feel free to ask about less expensive or generic medications and treatments. Sometimes there are things that we can do. So for example, if a lower cost medication, your provider knows may not prefer that because it may have some toxicities, but sometimes we can do things like we can write a letter to the insurance company and say, I'm not going to start with the lowest cost drug. I'm going to request coverage for the higher cost drug because I know that this toxicity is really important. Or you can try a short term with a generic in order to demonstrate, to see if it works. And if it works, fantastic. But if it doesn't, then that allows you sometimes to get coverage for the more expensive drugs. The one thing that's really important though, and I do want to say, is you don't want to necessarily threaten the success of your treatment. So if the less expensive drug is less effective, then this is something that we need to talk about, ways to find ways to get coverage for the more expensive drugs. So you always want to be weighing the risks and benefits of alternatives, especially for side effect management. And then clinical trials are actually something that can be very helpful here, because a lot of times the medications are covered on trials, and then there's usually something called, if the drug is successful, compassionate use, where a drug can be provided sometimes by a pharmaceutical company after the trial. So these are things to talk to your provider about. Labs and testing don't necessarily need to be done through perhaps the institution that your provider's at. They can be done independently in the community. And sometimes you can find places you can find testing centers that are less expensive. And then one thing that I think is really helpful is to be a little bit thoughtful about how you schedule your appointments. If you group appointments, not only can you generate hopefully some fewer copays. If testing is grouped, that can be very helpful, but also it takes away from things like time off work, or time off work for your caregiver as you navigate travel and visits to the hospital or visits to the clinic. Dealing with medical bills, again, this is not something I'm an expert in, but I have spent some time trying to think about sort of all of this. And just as a patient in my own experience, I think one thing that's important is just to understand what the process of medical billing looks like. So after you have any kind of treatment, whether it's a primary care visit or a visit with your cancer provider, your insurance company is going to send you a lot of mail. Usually it's snail mail, but it might come electronically. They often will send you a notice that we received a claim, that we're processing the claim. And then there's this thing called an explanation of benefits. And this will be I think something that's actually, this is a piece of paper that you want to hold on to. So your explanation of benefits is something that tells you not only what was done by your provider, and this is something here you want to actually check and make sure that what was done was actually done. It tells you how much was charged, and then how much your plan is going to cover, and then ultimately it tells you how much you're going to be expected to cover at the very end. And some EOBs will also include what's called your out-of-pocket maximum. It kind of keeps track of where you are during your annual spending, so you know how much of you've already kind of contributed, and at what point you're not going to be expected to pay anymore. This is important because the EOB is what tells you what you're responsible for based on what your insurance company says. The bill may be different from your EOB. And so one thing that I've learned in sort of doing some education of myself on how these insurance companies work, and as a patient, is you want to make sure that your bill matches your EOB. And so you want to make sure that you get the EOB before you pay your bill. And I think that you want to kind of do your due diligence here to make sure you're not necessarily overpaying. Once you've paid a bill, it's kind of hard to get money back if accidentally your EOB and your bill don't match. And that can happen, where the hospital bills you for more than your insurance company said that you needed to pay. So I would say that one strategy is, if the bill comes first, contact your provider and just say, hey, I haven't gotten my EOB yet. I'm just going to wait until it comes. Once I see it, I'll pay. I'm just going to make sure everything matches. And that's generally an accepted practice. Again, check and make sure your bill is accurate. And I will tell you, this is very confusing. It's confusing for me as a provider. I think this is a great way if friends and family are sort of trying to give you a hand or support you as you're navigating your care. This is a good time to sort of say, hey, can you help me just look at these? I've got a lot going on. Can you just look at these bills and help make sure that I've done my math right and I'm on top of everything and I'm not overpaying for my healthcare. So that's the insurance piece. And I think that in general, as I said, don't hesitate to, one, advocate for yourself. If a bill doesn't look like it makes sense, talk to your hospital's financial, the financial office. But I think this is also, and obviously, get organized and try to keep your papers, don't throw them away. But I want to talk now about what are some other strategies that we can utilize to kind of defray these costs and minimize that financial toxicity. So indirect costs, or lack of sort of the impact of seeking care, not the actual cost of care, but the fact that you had to pay for gas to drive to your visit, the fact that you had to take an entire day off of work in order to go get a scan and some blood work and then visit with your doctor. Those indirect costs, there are things that we can do to minimize those. So the first thing is grouping visits, like I talked about before. If you need to see your surgeon and your medical oncologist and they both are an hour from your house, try to schedule the appointments in the same day so that when you go, you get all your visits done and you can work with the scheduling team to make sure that that works. That's one day off of work as opposed to 2 days off of work. COVID has devastated so many of us and has caused so many problems for us in the country. But one thing it has done is it vastly accelerated and improved our telehealth options. And I think that telemedicine is a really important strategy to help minimize indirect costs for patients. So I am a provider in Seattle. I take care of patients who live as far away, many of my patients as far away as Alaska. I have worked to get medical licenses in multiple other states so that I can provide telehealth across state borders. If your provider can do the same, this is a great way to do a quick visit so that you can. I have patients who actually will take their telehealth visits from work. And forgive me for 1 second here. So if a patient is coming in, has a 15-minute follow-up to look at a scan. They had their kidney cancer surgery 3 years ago. They're doing great, partial nephrectomy and no problems. It's their 1-year scan with lab values. That's a 15-minute visit. There's no reason for somebody to drive 4 hours to see me if all we need to do is a quick check and let me show their scans. This way on telehealth, I can pull the scans up, I can show you everything, I can look at your labs, I can make sure that your primary care is aware of your kidney function, I can make sure that all of that is done. And some of my patients will even take that in a quiet room at work so that they've been able to get their visit without spending the money on gas, without spending the money on a flight if they're coming from Alaska. And we can accomplish everything. Now, if there's an exam that needs to be done, that's different. And obviously, like in a pre-surgical consultation, I like to see people in person. I think that there's no accounting for the value of meeting someone in person as you're doing a difficult consent visit or doing a proper physical exam. But there are lots of options to use telehealth to defray these costs going forward. Crowdfunding has become a very popular way to help support and sort of mitigate financial toxicity. This is a way where there are basically, you can use websites to engage families and friends say, hey, what can I do? And you can say, hey, I'm really struggling. I need some help with my bills, my medical bills. It's sad to me that we live in a country where this is something that patients have to turn to, but unfortunately right now that for a lot of people is a reality. There are different platforms that are very reputable and are utilized pretty widely. I've listed a few of them here. I do want to put the caveat forth that there are some considerations if you're thinking about crowdfunding your medical care that you probably want to just think about before you do it. First of all, there's privacy concerns. Your medical information when you put out one of these calls on a platform becomes more widely known. It's important in terms of things like if you're thinking about if you disclose health information that you may not want to be shared once it's on the internet, it's hard to know who's going to have access to it. The other thing is if you do have support through other programs that have specific eligibility requirements regarding how much money, your total annual income or the amount of money, that sort of influx of cash from a crowdfunding platform may impact your eligibility. So things like Medicaid or social insurance or student aid, those could be jeopardized. And so again, it's just something to sort of think about before you jump into crowdfunding, and to be really thoughtful about. There are a number of financial assistance options. Unfortunately, they all have different applications and they all have different eligibility criteria. So it can be a lot of work to figure out whether or not you might benefit or you might be a candidate for different options. But there are assistance options at local, state, county, and community levels. There are multiple cancer organizations that have funding for patients, and advocacy organizations that have opportunities to help support patient, whether it's patient travel or medical bills. There are private programs that you can apply for. And then there are, through each cancer center, there are oftentimes financial assistance options, whether it is navigating assistance and decreases in your medical bills, or things like cost reduced housing, transportation, parking vouchers. These are things to ask your provider about, and certainly to again go through with the navigators or the social workers to see what are my options here. How can I reduce how much money I spend on a hotel when I come in for my surgery and my family has to stay in a hotel while I'm in the hospital. So things like that can be really, really helpful. And then managing prescription drug costs, there are a number of different sort of pharmaceutical and specialty pharmacy assistance programs out there. This again requires some due diligence. There are oftentimes ways that you can actually substantially reduce copays, substantially reduce the cost of drugs, and many pharmaceutical companies have discounted costs. So a great example of this is Eliquis, which is a blood thinner that a lot of our patients end up needing at some point. There's a way through the company where you can drop the copay from about $75 a month to $10 a month. And it's a lifelong voucher if you just go to the website and go through a couple of questions. So I think that understanding and sort of looking for these can be very, very helpful. In the setting of the COVID pandemic, there have been a number of other financial assistance options that have been available to our patients, not necessarily for medical assistance, but oftentimes for things like mortgage release, rent or eviction moratoriums, food assistance, and things like that. And many of these programs are still active. And then I just put out here a couple of different resources that you can look up. There are numerous. Unfortunately, this is something that definitely takes a lot of active work in order to navigate, but these resources exist, and it's important to know that financial toxicity can be reduced. But this is definitely an area to kind of engage your families, your caregivers, and your providers to help empower you to reduce your costs. And ultimately, there's no one size fits all solution to managing financial toxicity. I think that creative thinking can be needed. So it may be that you can't reduce how much the immunotherapy is going to cost, but you may be able to find a way to take less time off work. You may be able to find a way to reduce the cost of housing when you go to the hospital. There may be a way that you can find some assistance with paying for some of your other house care costs. So, ultimately at the end of the day, it's about maintaining your financial wealth as much as you can as you're going through healthcare, whether you save money on healthcare costs or on home management costs. You're just trying to keep as much of your financial stability as you can. And I think ultimately just don't be afraid to ask for help. Speak up to your provider early and often if these are concerns. There are things that we can do and we are all willing to do. I would hope. I certainly work with a lot of my patients to try to minimize the costliness of their care. And ultimately, this is something that we can definitely, it's a problem, but there are some creative solutions. So with that, I want to thank you so much for the opportunity. I'd like to thank the KCA for the chance to speak with you today, and I'd love to answer any questions.
Wonderful. Thank you so much for that. Again, put your questions into the chat, and I'm going to start out with one on my end. You talked about some of the programs that like the drug companies provide, for instance. Why is it that those aren't provided up front? Why is there so much work for patients to do in order to try and sort of access those?
It's a great question. I don't know. It comes from the fact that healthcare is, I suspect healthcare is obviously a business in this country. And we live in a capitalist market, and the companies are trying to increase their financial, they have financial objectives in terms of optimizing their productivity. I don't know why these things are so hard. I wish they weren't.
I think there's part of it too, we always think of them as the money hungry, there's tons of things on Netflix now, money hungry pharma companies, but it also, they do need that money to do additional research. And so it's not just that they're using that money always to pad pockets, but really to help move the field forward. And I think there are some insurance regulations too on what they're allowed to offer right up front versus what people actually have to formally have paperwork and apply for in order to be in line with those insurance rules and things too. But it's definitely something that's worth investigating.
Well, and I think it's just important. I mean, ultimately, the cost of healthcare in this country is substantial.
Yeah.
I wish that wasn't the case, but there are things that are like, so clinical trials, for example, are incredibly expensive to run. And unfortunately, not all of them are successful. So you have to think about the fact that these companies are trying to develop new drugs that will help our patients and bring, like, if we think about in kidney cancer alone, the incredible change in how we care for people in 2022 compared to when I was in training in the early 2000s, we have, 19 first-line therapies in the metastatic space now, plus we used to have 2, and that's due to these incredibly sort of incredible productivity and drug development and drug design and these clinical trials. But for every one of those drugs that worked, there were a lot of drugs that didn't, and those trials had to be funded. So drug development is an incredibly expensive
Absolutely.
avenue, and I certainly, it's not all about the fact that everything is about sort of being money hungry at all. It's just that the process of healthcare is of providing healthcare, providing high level healthcare, and developing better ways to take care of our patients. It's expensive work. So that's part of it. But I do, as a provider and as a patient, as a, my family members, like, it is challenging to navigate. And so I think that being aware that these options are out there is really important, and providers need to speak. I feel strongly like we need to speak. I often will give patients resources. I'm like, I know that there's this program. Here's a way that you can get this drug for a lower cost. We need to be creative because financial toxicity is real.
Absolutely. And I do want to let people know that are listening in, we do have drug sheets that are on our webpage that are in the process of getting updated. And every individual drug sheet will have the patient assistance program for that particular company or that particular drug, the links to that and the phone numbers for that on each drug sheet. So you don't have to try and play, find hide and seek on their websites to try and find out where those web pages are. So hopefully that'll make things easier for you. Another question coming through is, if you're on Medicare and your treatment changes to a drug that's not currently covered on Part D, what's one of the best ways to mitigate that until the next enrollment period?
I don't know that I have a great option for that. I think the first thing I would do is I would go to, generally to the financial office at your hospital and ask about assistance programs. That becomes a situation where I think if you're in a situation where you have to buy private insurance in order to supplement drug cost coverage, in that time between open enrollments, unfortunately, I think it requires some creative solutions. I don't necessarily have great options, but I think the social workers oftentimes have, they may have some ideas about sort of either assistance programs through the hospital or assistance programs through some of those other organizations that I shared with you.
Yeah, you make that was sort of one of the next questions coming up, is who's the best person at a hospital to ask about help with financial resources? It's not necessarily going to be your clinician or the front desk person in the office. And you mentioned a social worker. I think earlier on you mentioned, or someone mentioned in one of their talks, those patient navigators that work within the hospital system. Anybody else you could suggest in terms of key terms to think about and ask where that person may be?
Absolutely. So to your point, as a provider, I don't have any way of knowing what a patient is individually going to get billed, even for my services, because it varies between patients by insurance program, by sort of their deductibles, by all of these things. And that's a hard thing. Patients ask me, how much is this going to cost? And I have to say, I don't know. But you can go to the financial office and they will give you an estimate of how much it's going to cost. And then you can actually send that to your insurance company and say, okay, how much am I going to owe? So you can, there are ways to understand what these costs are going to be. I strongly advocate for the use of those the patient navigators. I think they're really helpful. They're oftentimes nurses who have a lot of a sort of understanding of the inner workings of a cancer center, and they know where all the resources are. So they're great people to get on your team. Social workers for sure. And then patient advocates. So patient advocacy organizations like the KCA, I think, are great resources for patients. They may not be institution specific, but a lot of times that's where you can find some of the more creative solutions. Patients talking to one another is definitely one of the ways I learn a lot from my patients about what they use. Then I kind of keep a list that I can provide to my future patients. But within a hospital, then I would say the first person you go to is usually a social worker or a patient navigator.
Yeah, and that's one thing, I have sort of been and with genetic testing, people always want to know what the cost is going to be and researching that. And I think one thing to keep in mind is that if you have Blue Cross Blue Shield, it doesn't mean that everybody that has Blue Cross Blue Shield has the same answer, because there's so many different plans based on the state that you're in, what your employer contracted for, what type of plan you picked. And so it's not sometimes an easy answer either. And so the way that you said about getting the cost and then calling that insurance company to sort of say, what's my, cost coming out of that is important.
Yeah, absolutely. I think that's so important.
Yeah.
It's definitely helpful. I tell patients that before their surgeries, I say, call your provider and ask, so because the surprises are always there's nothing fun about that.
And I know my insurance, if you look it up, will actually say like this provider does try and keep, better costs than other providers. They're starting to now keep a little bit more track of that. So you definitely want to go and check out your insurer website as well and look that up for your particular plan. But I want to thank you so much. I think financial toxicity is one of the number one things we get questions about. It's a reminder to everyone out there that we do have our patient navigator program that you could call us or email us. We have a social worker that has her own resource library for people across the United States. And if she's not on her resource list, she will research it for you. So it's a really great resource for you. We also have a patient assistance fund that we launched this year. And so there's information on the website about that. And if there's people out there that have the ability to donate to that so that we can increase that for more patients in the years to come. We want to help reduce that toxicity for patients as well, even if it's just a little bit at a time. So thank you very much, Dr. Sitka, for giving the talk today. We're going to take our last big break for the day. We're going to circle back at 1:15 for the next talk, which will be me this time, on the genetics in kidney cancer. So we'll see you guys in about 13 minutes.